stage 1, high frequency brain waves is connected to your wakefulness. As we move into stage 1 of sleep, our frequency and amplitude decreases. We then enter a pattern of theta waves. Theta waves is slow brain movements, slow brain waves produced during the hypnagogic state with a frequency of about 6 to 8 cycles per second, accompanied by rolling eye movements. Stage 1 is the lightest stage of sleep. If awakened from this stage of sleep, we may feel we weren't sleeping at all.
Stage 2 of sleeping, also known as non-REM sleep, is a period of light sleep before you enter deeper sleep. Your heartbeat and your breath begins to slow and muscles relax even further. Your body temperature drops and eye movement stops. Brainwave activity slows but is marked by brief bursts of electrical activity. This stage lasts for about 10 to 60 minutes. You spend more of your repeated sleep cycles in stage 2 sleep than any other sleep stage.
Stage 3 is deep, slow brain waves, known as delta waves, that begin to emerge during non-REM. This stage is also referred to as slow wave sleep. This is a period of deep sleep where any noises or activity in the environment may fail to wake the sleeping person. Stage 3 lasts only a few minutes and constitutes about 3 to 8% of sleep. Getting enough sleep in this stage allows you to feel refreshed the next day. During this stage of sleep, your muscles are completely relaxed, your blood pressure drops, and breathing slows, as well as you progress into your deepest sleep. It is during this deep sleep stage that your body starts its physical repairs. Meanwhile, your brain consolidates declarative memories, for example, general knowledge, facts or statistics, personal experiences, and any others things you have learned throughout the day.
With stage 4 being one of the more relaxing stages, this stage is where deep sleep starts. Your eyes nor body don't move, which makes it a non-REM sleep. From this stage, it would be difficult for you to wake up, and when you do wake up, you'll be grumpy and you'll be tired. Also during this stage, your heart and respiratory, the rates decrease.
Stage 5 is the final stage of sleep and is where the sleeper begins to dream. In stage 5, the eyes move rapidly behind the eyelids. This is why it is also known as REM sleep. Breathing becomes shallow and rapid during this stage. The muscles become very relaxed and can be thought of being in a state of paralysis. This is believed to be due to the dreams, and so the dreamer does not act out his or her dreams.
Sleepwalking. This involves getting up and walking around while in a state of sleep. Sleepwalking is more common in children than adults. Sleepwalking is usually outgrown by the teen years. Isolated incidents of sleepwalking often don't signal any serious problems or require treatment. However, recurrent sleepwalking may suggest an underlying sleep disorder. Sleepwalking in adults has a higher chance of being confused with coexisting with other sleep disorders as well as medical conditions.
Sleep terror is frightening dreamlike experience that occur during the deepest stage of non-REM sleep. Sleep terrors usually occur during the first 2 cycles of the night. The experience of sleep terrors may look/feel like a pounding heart and an increase in the amount of breaths you take. May suddenly sit up, talk incoherently, toss and turn. Whoever has experienced this is never fully awake and return to sleep normally.
Insomnia is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or can cause you to wake up early and not be able to go back to sleep. It can be symptoms of underlying conditions. The symptoms include difficulty falling asleep at night, waking up during the night and not being able to return to sleep, waking up earlier than desired, feeling tired after a night's sleep, daytime fatigue, irritability, depression or anxiety, poor concentration and focus, and even difficulty socializing.
Sleep apnea is a condition marked by abnormal breathing during sleep. There are temporary breathing lapses that can cause lower quality sleep or even lead to bigger health problems due to the lack of oxygen the body is getting. It can affect anyone ranging all ages and both sexes. It is, however, more common in men. 3 kinds of sleep apnea are obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. OSA is when something is obstructing the back of the throat and breathing is broken. in this way. CSA is when there is a problem in the brain system and the muscles involved with respiration lose controlling aspects and hinder the breathing in this way. MSA, or complex sleep apnea, is when both previous sleep apneas are taking part in sleep. Some symptoms of sleep apnea are disrupted breathing, excessive daytime sleepiness, morning headaches, irritability, limited attention span, and difficulty thinking clearly.
Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of sleep. People with narcolepsy find it very hard to stay awake for long periods of time. It can cause serious disruptions to daily routines. Symptoms include daytime drowsiness, sudden loss of muscle tone, sleep paralysis, change in REM sleep, and hallucinations. This can be very dangerous because people with narcolepsy can fall asleep during any task.